San Jose Mercury News in 2013, 74% of homeless people living outdoors are vulnerable to many illnesses and diseases. Each day we take for granted the bed that we sleep in, the food that we eat, and the ability to go to the doctors if you aren't feeling well. Homelessness correlates with health because most suffer from severe alcohol abuse and its side effects, as well as mental and chronic illness. We must become advocates for homeless people to create solutions and prevent progression of diseases and health problems. So one of the main reasons that these people develop physical problems is due to the living quarters that they live in, whether it's inside a shelter or outdoors, because they're living with many people who are susceptible to many diseases. According to Culhane and Brine, 70% of homeless people, the homeless population is due to a disabling condition. This condition causes them to lose their job, which in turn causes them to lose their health care, their home, and a sense of stability. And it's hard for these people to recover from this condition. According to Dr. James Plum, 40% of people who have at least one chronic health problem are unable to seek help for this. And they go untreated due to the lack of health care, and it leads to premature death. He also, Dr. Plum also says that AIDS is the leading cause for homelessness, and the treatment is not effective because they're not able to consistently provide them with the needs that they need, and their medication is very costly, and it's hard for them to get health care consistently enough for them to either prevent AIDS or also cause death not to become so prevalent. In addition to physical health problems, homeless people often suffer from mental illness, and this is an effect of homelessness, and also can happen. Homelessness can happen because of their mental illness. According to Kuhn Hawkins Kahala, 20 to 25% of single adult homeless population suffer from mental illness, and the top two are schizophrenia and severe depression. Severe depression is also found more in women than in men. This can be a result of substance abuse, and 38% are dependent on drugs due to their alcohol and drug abuse. They're also more vulnerable to drug and substance abuse and the effects of the drug itself, according to Kuhn, Hawkins, and Kahala. However, most homeless people suffer from mental illness due to physical and sexual abuse that happens while they are living outdoors, and this can be due to crimes that are committed by their fellow individuals that they're living with, or living outdoors with, or just due to hate crimes. And these homeless people suffer from PTSD because of this physical abuse and also sexual abuse. This leads to severe depression, and they're not getting the health care that they need for these attacks. So infection increases, also AIDS, and pregnancy. After focusing on the physical and mental health problems, the next question is, how do we even approach this problem, and what are the steps that we can take? So the U.S. government and also other organizations are asking people to provide donations so that they can work diligently to provide services to promote the well-being of these homeless people. According to the San Jose Mercury News, in 2013 of December, doctors and nurses and nurse practitioners of the Valley Homeless Healthcare Program donated their time to take care of these individuals, and they went around giving them blankets, providing the health care that they needed, and just talking to them one-on-one was a great help. They also administered preventative measures such as tetanus shots, oral HIV tests, checking blood pressure, and treating any infections that they had. And they did this weekly because it was during the colder months. They wanted to make sure that they were preventing premature death. However, they were only able to help 20 patients. And this This brings a very personal thing to me because this is something that I want to do. That's why I want to become a nurse, so that I can donate my time to help people in our community. And this was in the Santa Clara County that these people were able to be helped. So although we do have street services and health clinics throughout California and throughout the nation, people do not have the ability to walk there or the trust to walk to these services. And members of the Valley Homeless Healthcare Program, the reason why they did help these people on the side that were living in tents is because they wanted to reaffirm their faith in the homeless people's faith in the medical system. And their lack of faith is because of past experiences when they're in the hospital, and also their mental instability because they're untrusting to get the help that they desperately need. The last thing is CATS stresses the importance of getting a photo ID so they can have access to social services or a job, and it's also beneficial to healthcare. The continuance of homelessness is due to the quality and consistency of the physical and mental services for these people. If we promote the well-being of these individuals and provide them with regular services for people that are homeless and at risk for homelessness, we can prevent these people from living this way. Currently, there are 800,000 homeless individuals in the United States. We must become the generation that creates a silver lining for these people by providing the health care that they need so they are no longer neglected. Thank you.